Donovan?
Yes.
Good afternoon, Miss Donovan. How are you doing
Fine,
today?
thank you.
I'm doing very well. Thank you very much. And thank you for making the time to come in. All right. My name is Baha. I will be your dental assistant this afternoon. Please, would you come with me to the room,
I
please?
sure.
Thank you very much. I like your outfit.
Oh, thank you.
Pleasure. Thank you. This will be please. Thank you very much. All right. I will have a seat.
Okay.
Thank you very much. Sure. How's your day been going so far?
Great. How about you?
It's a wonderful day. It's a wonderful day
I'm
coming
so
to work. Thank you very much. How was the traffic on your way coming over here?
Oh, I'm only about 5 minutes from here, so not
Great,
bad.
great. That saves you a lot of time. You know,
Yeah.
Houston's always chaotic. There's always
That's
traffic.
true, you know.
All right. Thank you very much. Ramzan, how's your family been doing so far?
Great.
Great.
Fantastic.
All right. Do you have any grandchildren?
Yes, 5 grandsons.
Great, that's really good. I also came from a big family, and my grandma, she had a lot of grandchildren.
Well, 2 of them live with me. So.
Great, how old are they?
21 and 19.
Are they behaving well?
Actually, fantastic grandsons.
Great, great, I'm so
They treat
glad.
me like a queen.
Oh, this is really, I'm really happy to hear that. I'm really happy to hear
Yeah,
that.
so
Thank
am I.
you for you. Thank you for sharing that with us. And Mr. Donovan, are you doing any work or are you retired?
No, I stay home. I babysit my other grandson, my 11-year-old grandson.
Oh,
so,
okay, that's
yeah.
like, this is
My
your
daughter's in
full-time
nursing
job.
school.
Oh, great,
So.
great. Or is when she's gonna be graduated?
Oh, well, she's going from an LVN to a registered nurse, so it takes her a year. So she just started in June.
I'm really happy for her and
So am I.
congratulations in advance.
And she's buying a new house, so.
Oh, congratulations, congratulations. This is a really good step to move forward in our life.
Sure.
Excellent. Excellent. All right, so Donovan, okay, in order to better serve you this morning, and we have some value that to provide our exceptional quality care for every single patient that they come to the office. So before we started, I had a few questions, please, and would like to go through them.
No problem.
And we'll take it from there.
Okay,
Correct?
sure.
Absolutely. Ms. Donovan, among our team in our offices, of our dental offices, there are 4 important values that drive our exceptional health care, our dental care in here. And all of these are very, very important to us. And which one would you consider is your #1 priority for your visit today? Isn't it comfort, pain-free smile, and a pleasant visit? Function, able to eat, chew, and bite properly. Cosmetic, how your smile looks. Longevity, long-lasting result. Which one you consider for your today visit's #1 priority?
Pain-free.
Pain-free. Would you tell me more about that?
I'm a little nervous at the dentist.
Okay.
I get a little nervous at the dentist. I'll be honest with you.
Okay, thank you. Thank you for your sharing your experience.
The
Is there-
shots, actually.
Oh, the shots. Do you have any previous experience you would like to share with me so
Ah.
we can be assured that when we get to this part, make sure you will pain-free and you won't feel anything during the procedure? And would you like to share any story or any
Well, I
experience
had
with us
one
before?
root canal,
Mhm.
and I guess they said my root was really long. So the one dentist couldn't do it, so he had to send me to another dentist to have it done to I don't know, the professional that just does root canals, I guess. And that was a bad.
I'm really sorry you
That was
had this
bad.
bad experience.
Yeah.
When was that? If you don't mind me asking.
Probably 3 years ago, and I'll never forget it.
I'm really sorry. I'll make sure you have an excellent experience, and
Oh, I'm
I want to see this smile when you leave here today. All right.
Yeah.
If you consider any future treatment, what would be your what would be one of your barriers if you consider any treatment in the future?
I don't. Oh, the You mean the fear and,
Yes,
well,
because as you mentioned.
yeah, that's
briefly-
that's my biggest thing is fear at the dentist, I'll be honest with you.
Right, and already you already shared this experience. Okay,
Yeah,
I'll
I'll
make
be honest with you, that's.
I understand how you feel. A lot of patients come through this, but I will assure you, you have an exceptional doctor. Dr.
Oh, I'm
Manish,
sure.
like today's Dr. Manisha working here, she's an excellent dentist.
Oh.
She's my number one, and I'm very sure it's gonna be your number one as well.
Oh,
All our doctors like provide an excellent quality service. Like
That's good to know.
our patients are number priority. Like we pass our difference, but you always are number one priority. We'll make sure
Nice
take
to
care
know.
of you, and we make sure providing exceptional service for you.
Mm-hmm.
And please, if there's like any feedback or anything at the end of the day, let us know so we can work something in the future to make sure our team providing excellent service for every single
I
patient
sure will.
every time. Thank you very much. We'll be with you shortly.
Okay, thank you so
And
much.
if there's anything else I can do for you before I leave.
No, thank you.
All
You've
right.
done everything you could.
Thank you very much. And my name is Baha, and it's an honor to meet you.
Yes,
Thank you
you
very
too.
much. All right, give me a few minutes. Okay?
Sure.
Thank you very much.
And thank you.
My pleasure.
Okay.
Whenever you want.
Okay.
We're waiting for you from one, okay?
Okay.
Thank you very much.
Thank you.
Mrs. Donovan, this is Dr. Manisha.
Hey, Miss
Dr.
Donovan.
Manisha.
Nice
How
to
are you?
meet
Nice
you.
to meet you too.
It's my number one doctor. She's the
Oh, thank you.
favorite one
Number
and
one.
the one that I just spoke and told you the good things about her earlier.
That's right.
Dr. Manisha Donovan came here today, and she been living in Houston for a long time. She lived like 5 minutes away from here.
Oh,
Do you
that's
believe that?
awesome. That's so convenient.
It is very, very convenient.
Mhm.
So she will not have any bad experience with the traffic at all.
Yeah, right. It means a lot.
It is. And she had a very lovely 3 grandchildren,
Oh.
and 21, the age is 21, 18, and she's full-time with the 8 years old. And her lovely daughter, she's in a nursing school. She's actually doing the register nurse. She's almost there. And 1 year, and she's going to be graduated very soon. And also, she got a new house. Congratulations.
Yes.
That's
All right.
It's being built right now.
Oh, that's amazing.
Yeah.
Great. And also, as I mentioned to her, like our teams in our office, we have the 4 value, and then that we can provide an exceptional dental care for every single patient that comes to our office. And her number one priority is comfort,
Okay.
because she.
I gotta think about pain. It's terrible.
And her number one priority is comfort, and she don't want to feel in pain.
Okay.
Especially like when you do the local injection, she don't want to like feel the needle, and then I assure her she's in a great hand, and we'll make sure would experience that with us today. And also her barrier is fear, and due to her unpleasant experience before. She went to a dental office for a root canal, and unfortunately, the doctor referred her to another doctors. She went there because of the root was very long, and she had a really bad experience at that time last year ago. And as we spoke, we understand how a lot of patients feel that way, and we can assure you that our team's an exceptional, and Dr. Manisha,
Did you
she's
hear that?
Dr. Manisha is in one of the best dentists that we have in our offices, and you're in a great hand, and you don't have to experience same experience as you had before, and we'll assure you that we will do whatever it takes to see the smile when you came, same smile as you leave. All right?
That sounds good.
So, Miss Donovan, pleasure meeting you, and thank you for choosing us as your dental providers, giving us a chance to serve you. Like Baha said, we're all about service. We're all about what it takes to make you feel comfortable, what it takes to make sure you have a pain-free experience. So, tell me a little bit about yourself. I mean, granddaughter graduating off of
Oh, no,
nursing
my
school.
daughter.
Daughter's graduating off
Daughter.
nursing school. That is so amazing. Must be,
Yeah.
are you guys excited?
She's an LVN right now, but then
Great.
she went back to school again for
Awesome.
you know, so it'll take her one more year. She'll graduate in May.
Okay, May coming
Right.
up. So we've got to make sure you're all ready and set for graduation so you can show your pearly whites. So we're going to make sure we keep that graduation in mind while
Sounds
we're scheduling these appointments. All right, so like, as we know, and we talked about it, that comfort and pain-free are your number one, you know, like priorities. So here's how it goes. We make sure absolutely that every patient here has an awesome experience. Like if the fear of injection, we've got, you know, the topical, a little jelly that we apply before we administer the anesthesia. So most patients, actually all of them pretty much say that it was a pain-free experience.
Good.
So whatever we're gonna cater today, we're gonna make sure that we keep it around those lines, keeping and making sure that you're comfortable and you have a pain-free experience at all times.
Appreciate
Um,
it.
I'm gonna take a quick look at your x-rays, we're gonna take a quick look in your mouth, and then I'm gonna bring in my treatment coordinator and we're gonna discuss and make this happen for you. All right?
Fantastic.
Okay. So I'm just gonna bring this chair down a little bit.
Okay.
Sure. All right, Miss Donovan, we're gonna take a quick look and we're gonna tell you what's exactly going on and how we can get you started and taken care of today, okay?
Okay.
Just gonna gently blow some air. Number 12, build up in crown. Number 13, build up in crown. And SRT 4 quadrants. I'm gonna just raise this chair up a little bit. You can close.
Okay.
Miss Donovan, my whole aspect of having Shannon around was to make sure that we are all on the same page and she understands the treatment plan. And so she can best assist you to get this taken care of in the best possible financially, not, you know, getting most of your insurance benefits and making this happen for you. Having said that, I'm looking into getting, your requirements are pretty straightforward and very simple. And you made it here in the right time so we can take care of all the situations that you're facing. I want to start off with a nice deep cleaning. So we're talking about a deep cleaning because I'm a believer that gums are the foundation of your teeth. And so it's very important that they're healthy at all times. And the other thing is on your upper left, I'm just going to show you some x-rays right here.
Okay.
So you have these two big silver fillings right up here.
Okay.
And as you can see, the white part is actually occupying a larger portion of the tooth. Having said that, my fear is that when you could be eating on something as soft as a cake or something as crispy as a peanut, my fear is that this tooth might fracture on you. So
Okay.
we're looking into getting some crowns in place for that. Ms. Shannon, our treatment coordinator, she's amazing. She's always kept the comfort, the budget and all that for all our other patients in mind when she treatment plans this. So if you're committed to get this started, looks like my schedule does permit it. Would you want to take care of it today?
Sure.
Okay.
Sure.
If there are any clinical questions I can answer for you before I let Ms. Shannon take it from here.
Okay.
Anything I can help you with?
What side is it?
It's on your upper left.
On my upper left. Oh, okay. Okay. Yeah, I got a little bit of pain there.
Okay,
Mhm.
okay. So a crown would be a good idea. So I think Ms. Shannon, she's really amazing, and she'll take it from here. And I'll be right back whenever you guys are ready to get this started today.
Fantastic.
All right. Thank you
Thank
so
you.
much. Thank you.
Thank you so
Thank
much.
you. Nice meeting you.
Nice meeting you.
Thank you.
Ms. Donovan, I'm gonna come in this side so you don't have to keep turning your head.
Okay, please, thank you very
Oh,
much.
sure.
And this is your glasses.
Oh, thank you so
My
much.
pleasure.
So, Ms. Donovan, since I understand that you like details, what I'm gonna do is kind of go over
Great.
your treatment.
That makes sense.
But before we do that, I just want to show you this is what you're looking at as far as the cost.
Okay.
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 So my question for you is, do you have a dental savings account set aside for you
No,
to?
I don't.
Okay. Would you like me to present to you a couple of options?
Oh, could you?
You have
Yeah,
the
that'd be great.
You have the option to pay this in full, or would you prefer monthly payments?
Oh, I guess it depends on how much it is.
Okay. So the way we work to assist our patients is we have two options. One, we can split the payment over the course of treatment. The other option is that we can look at a third party. Have you heard of Rooms to Go?
Yeah, we know.
Okay. You ever seen their ad where it says you can do 5 years interest free?
Oh, right,
Okay,
right.
so we work with this company. It's the same as Rooms to Go, Synchrony
Oh.
Bank. It's a healthcare savings credit plan.
Okay.
What they
Oh, I
do.
never heard of that.
Oh, awesome. Okay, well, we have two options. We have one which is Care Credit, and the other one is the Lending Club. Both of them are third-party financing companies, and what they will do is they will allow you to get your treatment done, and allow you to decide how you'd like to pay it back.
Okay.
Make it comfortable for you.
Oh, that's very interesting. I never knew they had that.
Okay, so I would like to take the opportunity to show you both plans, and you decide which one
Sure,
you'd like to.
sure.
You,
No, that sounds very good, yeah.
Okay.
That's probably the way I would go.
Okay, so it does require that I have two forms of ID. Do you
Okay.
have that with you? Two forms of ID. One is a major credit card, and one is your ID.
I've got my credit card, I don't have my ID on me.
Okay, so what we can do, I believe that when you first came in, they scanned your ID,
Yes.
so I can get that from there.
Okay,
Okay,
okay.
so I would like to tell you a little bit about those plans, okay?
Okay, sure.
They do
Oh,
offer.
I'd love to hear about it.
Sure.
Yeah.
Okay, so Care Credit is one company, and they offer anywhere from 6 to 12 months interest free,
Oh, nice, nice.
which means that you would only be paying back what you borrow from the company.
Oh, okay.
Okay, and then
Okay.
they do have what's called an extended plan,
Mhm.
which allows for you to choose between 24 to 36 months.
Okay.
They do have other plans available with the company, but I recommend that you only go as far as 24 months or 12 months with the company. The only reason why, Mrs. Donovan, is because the interest rate. But if that's not something that you are
Oh, how
comfortable.
much is the interest rate on
Okay,
that?
so it depends on how much we borrow,
Okay,
apply for. So let's say if you do the no interest, there's no interest involved.
okay,
And if you do the interest part down here,
right.
you would subtract what you're borrowing from this number here, and it would
Okay.
give you the total amount of interest that you're paying back to the company.
Mhm.
When we put that amount in this calculator
I
here.
see,
Okay.
I see.
So now, the reason why I say only 24 months to be the longest is because I don't really think people want to pay longer than 24 months. And then
I
the interest
understand that.
increases.
Mhm.
So if you have to go further than 24 months, I would like to take the time out with you to work out a
Oh.
different plan.
Yeah, no, I wouldn't want, never want to go that long anyway.
Not unless it's something you want to do.
Right.
Go further and
Right.
into to
I
the interest
understand
part.
that, yeah.
So I try to keep the treatment as cost efficient for the patient as possible.
That makes sense.